name's Grace Barrington and I was born on the 26th of January 1990.
Okay, Grace, we'd like to examine your eyes today and test your vision. Is that all right?
Yeah, that's fine.
So those the glasses that you normally use to look in the distance with?
Yeah.
If you could keep those on for me, please, and cover up your left eye. And then with your right eye, read down as far the chart as you can.
H, X, U, A. A, X, U, H, Y, X. That's it.
Okay, and if you could cover up your other eye for me, please.
T, C, H, X, U, H, U, Y.
That's great. Okay, now if you cover up your left eye again for me, please. Got some little holes here. If you could hold those against your right eye, look through the little holes and see how far down you can read.
H, A, Y, O, U, X. And that's it.
So now I'm going to test your near vision. If you just read the smallest line that you can, if you can't read anything on that page. Great, so if you could cover up your left eye for me, please, and read the smallest line that you can do at arm's length with your right eye.
And here it has wider scope and greater basis of the
That's great, thank you very much. If you could do the same with your other eye for me, please.
As we went along.
Okay, great. So I'm going to check your visual fields now. If you could take your glasses off for me, please. And if you could cover up your right eye for me, please. Look at my nose here. Is there any part of my face that's missing?
No.
And then cover up your left eye for me and have a look at my nose again. Is there any part of my face that's missing? Have a look at my eye there. And say when you can see my fingers.
Yeah.
Say if they disappear.
No.
Tell me when you can see my fingers.
Yeah.
Say if they disappear.
No.
Okay. Say when you can see my fingers. Say if they disappear.
No.
Say when you can see my fingers.
Yeah. No.
Now I'm going to examine your pupil responses. So if you could fix on an object in the distance for me, please. I'm going to shine a bright light in your eyes. I'm going to go from one eye. Now I'm going to go from one eye to the other eye.
You don't know there is one mic on and
I'm now going to test how your pupils respond to focusing close. But have a look at the light switch there in the distance. And then have a look at my finger here. Okay, great. So I'm going to check your eye movements now. You could have a look at this red dot for me. Are you seeing one or two red dots?
One red dot.
Okay, if you could follow it with your eyes and keep your head still for me, please. And tell me if you get any double vision. Any double vision there at all?
No.
Okay, thank you. Okay, Grace, I'm going to have a closer look at your eyes now with this machine here. If you could have a look for me in the distance over there, perhaps at the light switch. I'm going to come closer and there's going to be a bright light. I'll pop a hand on your shoulder so that we don't bump into each other. Okay, and look at the light for me, please. Okay, that's the end of the examination. Do you have any questions before we finish?
No.
Okay, thank you very much.
Thank you.
Okay, Dr. Satish, you're here.
Yeah, I'm here.
Okay, now I will give you the case, okay? The case will be same. It will be an eye examination. That's why I wanted you to watch because we will not do any mistakes, okay?
Okay, okay.
Stop, I don't know where it's playing. I don't know. I have really problem with the mics. During the video also, so many people were opening and I had to come back and close. It's really difficult. Please, please, please take care of your mics, please. So now our approach is before going to the eye examination, even though your command is eye examination, you will do the general comments, okay? The general comments like anything in the surroundings, any
Okay.
looking, ill looking, dimensions, that is short for age or tall for age or obese or whatever you see, all the general comments, and then you will go for eye examination. Okay, I will show you two pictures now. These are your cues for the station, and then we will start 6 minutes. Okay, so I'll share for you now. This picture you're seeing, this is the general appearance of the child. Okay, you can see the picture.
Yeah, I can see.
Yeah, this is the general appearance. Okay, you will describe the appearance of the child, and I will show you the second picture for the eye. Just see this picture for a few seconds and then I will change the picture. Okay, the second picture now. Okay, this is the second picture for the eyes. Okay, but in inspection, I want to tell you that you will see more redness in the right eye compared to the left, and also there will be some clouding in the right eye. Okay, which I did not get the picture. I'm just telling you, imagine here that you have clouding in the right eye, and also there is, when compared to left eye, there is more redness in the right eye. Okay, these are your inspectory findings. Rest all you will ask and I will tell. Okay, I will give you just 1 minute and then we will start. The station is for 6 minutes, right?
Yeah. Yeah.
And 3 minutes discussion or what? How is the
Yeah,
clinical?
It's
I
short,
mean,
yeah,
yes.
short clinical, 6 minutes,
6
he will
plus 3.
examine, and 3 minutes discussion, differential diagnosis and management.
Okay. Okay, fine. Okay, Dr. Satish, I will keep the time and we will start maybe in few seconds. Okay, so what about the time? They after the visual cues, they will give us time or no? Just you have to start directly.
After
That 4
6
minutes, I
minutes,
think.
after 6 minutes and 3 minutes discussion, then finish like this.
No, no,
And
no.
for
So,
preparation, 4 minutes. 4
In
minutes for the
Doctor,
preparation.
preparation, they'll give 4
I want
minutes.
to act like,
After
in this
showing
case,
the pictures, wait. After showing the pictures, they will give 4 minutes and telling about the station, like this is your
yeah,
new station.
universal clue.
Yeah. After universal cube, they will give you 4 minutes.
Give 4 minutes. Yeah.
Okay, fine. So I will tell you this. This is your neuro station, and you will
Okay.
examine the eyes of this patient. Okay, this is your
So,
command.
so
This is
you were
Rima,
saying,
7 years old girl. Rima, 7 years old girl. Examine her eyes.
okay, you were saying that the redness is more and there is corneal clouding in one eye only, right?
Yeah.
Or
Right
both
eye.
eyes?
Right eye. No. I am telling you, imagine, because I did not.
Okay. Okay.
Imagine that in the right eye there is more redness and there is clouding of the cornea. This is extra in inspectory points, which is not there in the picture. Okay.
Okay. Okay.
Okay. If you are ready, we can start. No problem.
Yeah, we can start. I don't know diagnose. I just go to the approach. Okay.
Okay. As I told you, she is Rima, 7 years old, and this is your neuro station. Examine her eyes.
Okay.
Okay, start.
So as I enter the room, I will introduce myself as Dr. Satish, and I will greet both parent and the child, and I will take consent for the eye examinations. Is that okay?
Yes, doctor.
Then I will wash my hand with the alcohol hand rub, and I will proceed forward. Is she wearing any spectacles?
Yes, she is wearing spectacles, and she has removed it now.
Okay. And is there any abnormal facial features, like any sort of?
Please
I can see some
describe.
choppy faces.
Yeah, describe
Yeah.
the features which you saw in the previous video.
Okay. Okay. Then how is her growth?
Short
Is
for a.
growth short for is okay. Is there any other clues like any walking aids or any supports?
No supports.
Okay. No crutches, right?
No
Okay.
crutches.
Okay. Is there any hearing aid?
No hearing aid.
Okay. So then I will proceed forward, and then I will ask her, do you have any ear pain?
Yes, doctor, I have pain in my left eye.
Okay. Then I will be checking your eye, and I will be sitting on the same level on you, and then I will ask you to close your right eye, and as I will show my fingers. Can you?
Okay, wait. Talk to the examiner, because in the exam
Okay.
there is no patient, right?
Yeah.
So you will
Okay.
tell the
Yeah.
examiner that you will close her
Okay.
eye and ask.
Okay. I will ask her to close her right eye, and then as I am sitting on the same level, I will ask her to, can you see my two fingers or not with her left eye?
Yes, she can see. You are asking to see the fingers. Yes, she can
Yeah,
see.
and then I will ask her to read any lines. Like I will show some charts, and she can read the lines with her left eye.
What chart you want to use here? What you will ask the
This, If possible, it is there, if there is available, I will
Yeah.
check
First
with the
we'll
Snellen's
ask
chart from
the
6 meter.
Snellen's chart available. Okay, it's not available. So what you will do? It's not available now. What you do?
Then I will ask any calendars or any
Yeah,
letters in the
something
wall.
is
She
on
can
the
do
wall.
that.
Yeah, something is on the
She can
wall.
read the line.
Yeah, she
Okay.
can read one line from that,
Okay.
from the right eye.
So I will ask her to close her left. Okay, she's closing her right eye, right?
No, no, right eye is, yeah, she's closing her right eye and read with the left eye. Okay.
Same with the right eye, closing the left eye.
Okay.
Can
Now
she do?
with the right eye, she's not able to read the line.
Okay. So then I will ask her to look at for any finger movements. Can she look for finger movements?
Yes, yes, she can look at the finger movements. Yes.
Okay. Then I will ask her to recognize the colors. Can she recognize the colors with her right
Which
eye?
you are asking? Right eye.
Right eye. Right
Yes,
eye.
yes, she can recognize, but only if you keep it near. From far, she cannot.
Okay. Okay. With the left eye, she can recognize or not?
Yeah, from with the left eye, yes. From the wall, she can recognize. No problem.
Okay. Then I will sign my torch. Yeah.
Okay, go ahead. Next.
Color vision. I'm checking for the color visions.
Okay.
This red, green, and yellow. Yeah, and then I'll sign the light on her right pupil. How is is there any cloudings or the white cornea? Okay.
Yes, in the right eye,
Okay.
you see the cloudy cornea, and also
Okay.
the pupillary reflex is slow. Means it's
Okay.
constricting, but it's taking time. It's slow in right eye.
Okay. Okay. So when I put the light on the right eye, is there any reflex on the left eye?
Yeah, left eye has the reflex. Yes.
Okay, I'll put the light on the left sign, the light left eye, and I'll see the response on the both eyes.
Yes.
How is it? Okay.
The left eye constriction is good, and the consensual response in the right eye is slow.
Okay, then I will ask her to look at the mirror and suddenly look at my finger closing her right eye. Okay. It's and I look for the pupillary change in the pupillary size in the left eye. Is there pupillary response there?
Yeah,
Accommodation reflex?
there is movement of the medial rectus. The eye gets converged,
Okay.
and the constriction is slow in right eye.
So okay, then I will ask her to close her right eye, and with her right hand, and then I will ask to see my tip of the nose. Can she see the tip of my nose?
Yeah, she can see.
Then I look for the peripheral field of vision with my over the full field. I will ask her to say if she can see my fingers if as I'm introducing towards the eyes to the center.
Yes. From the left eye, she can do very well this thing, but from the right eye, she has some problem. Means she is not well. There is
Okay.
little visual
Okay.
effect in the periphery.
Okay. Okay. So I will also I'll do
Finish.
as
Just continue. Finish.
test.
Okay.
Okay, I will do a as test with my. I will ask her to look at my tip of my finger, and then I will do as test to look for the ocular movements. How is the ocular movements in the right hand? First of all, I'll ask her to fix the head, looking at my eyes, and then
Her
move
ocular.
her eyeballs according to my fingers.
Okay. Her ocular movements are fine. No problem with the ocular movements.
So I will conclude my examinations doing the fundoscopy examination and the both eyes. And while doing the as test, I will be observing for the
Some problem. Make again. Okay, go ahead. Okay, go ahead, Dr. Satish. Please open your mic.
So while doing the as test, I will be observing for nystagmus.
Okay.
And I will conclude my examination doing the fundoscopy examination.
Okay, in order to complete fundoscopy. So
Yeah.
okay, so you will say that I want to do fundoscopy if it is available, because this is a part of eye examination. Then they will tell you if it is available or not. So in order to complete your examination, what you want to check in this child?
I'd like to do a complete 10 of examinations, including and then fundoscopy and
Okay. What
yeah.
else? You saw the child was short, chubby. What else you want?
Oh yeah, and then complete neurological neurological examination, including the abdomen, Yeah.
Okay, complete neurological
Yeah.
examination, abdomen. Anything else?
I like to look for the backs, also spines also, and
Okay, when you do neurology, complete neurology, it will come. Something important you are missing.
yeah.
Okay, we will discuss it later.
Okay.
Next, so present this case and give your differential diagnosis.
Okay. I examined a 7-year-old girl and I found her chubby with some Cushingoid features and with a distended abdomen and chubby face. And on my eye examination, I found her right eye has corneal clouding, likely to be a cataract. And rest of all our other examinations were normal, except in the right eye there was a corneal clouding with this sluggish pupillary response and less accommodation reflex.
And also the visual acuity was less.
Yeah, visual acuity was
compared to the
impaired.
left eye.
Yeah.
So what's your differential diagnosis?
My differential diagnosis would be any syndrome like mucopolysaccharidosis, and third will be trauma.
Okay, first is mucopolysaccharidosis. So what is your second?
Second is this is a Cushingoid with the cataract. Steroid toxicity with Cushingoid syndromes and cataract.
Okay. So how do you want to manage this child now, presenting with redness, reduced visual acuity? What might be the problem in her eye?
It might be a even angle closure glaucoma.
Okay.
So I will consult with the eye doctor and
okay, ophthalmologist.
After ophthalmologist, and then might require the iridectomies and other surgeries.
Okay, anybody else you want to involve in the team?
I need to involve with the
No.
genetist. I would like to confirm my diagnosis first, and then I will, if it is a mucopolysaccharidosis, I will involve the genetist and
okay.
Also.
Okay. Actually, time finish, but I was just. So yeah, there is some problem in your diagnosis. We will discuss later. Now let me see the giga. 1 minute. Wait, just.
Rima, 7-year-old.
Okay. Yeah, you want some time? Want to start?
Just maybe just 15-20 seconds only.
No problem. Once you're ready, just tell me.
Okay.
3 minutes. You will talk to the examiner, okay? Not to the mother of the child, like your exam. Okay.
Yes.
You can start. I will share the eye picture for you better, I think, because this is eye examination.
Okay.
But you know the general appearance. Describe by thinking it. Just 1 minute.
Yes, yes. Yeah.
Okay, you can start now.
Okay, so first of all, I will introduce myself, take
Okay.
permission from the mother, and do hand hygiene and go to Rima and make rapport with her and check whether she is communicating with me or not.
She is well communicating.
Okay. Then I will I check that the growth looks like weight and weight looks more. So what is the weight and height in the
Yeah,
growth
she
chart?
is obese and short for age.
Short for days. May I know the BMI?
Not needed. Just she is obese
Oh,
and short for age.
okay. Is she in distress? Any special surrounding?
Not in distress. She is wearing glasses before, no
Glasses.
removed, and no special surroundings.
Okay. No, any dysmorphic features, anything?
No,
I
just
saw some puff. Okay.
yeah, moon-like
That's it.
face.
Okay. Then I will check for the eye examination. I'll proceed with the eye examination. First of all, I will inspect the eye to look for anything on the lids, conjunctiva, pupil, and iris.
The same thing what
So
you
I
have.
can see, yeah,
Yeah.
yeah. So I can see there is congestion, and yeah. Also, I will see the pupillary size. Is it both side equal?
Yes, pupillary size is both sides equal. Both sides equal.
Okay. Then I will look for the visual acuity. By if there is something on the wall, I will tell the Rima to read. So
Uh,
can something is there?
yes, yes.
And I will check separately each eye whether she is able to read that.
Yeah,
Is it
from the left eye, she can read what is written on the wall. From the right eye, she did not read.
okay? Then near vision, if any book available, also I will try to check it. And also I
Yeah.
will inspect the glasses, her glasses. So
Okay.
which she is using, whether convex or concave lens. Okay.
Near vision, again, left eye, she can read. For the right eye, she has difficulty. She drags the near to her. She drags the paper near to her to read from the right eye.
Okay. Then
The glasses, the examiner says no need. Okay, go ahead.
okay. Okay. Then I will check for the ophthalmoplegia. I will move my finger from the center, make a H-shaped line. So is the movement is equal in all the side?
Yes, yes, she can move all the sides.
There is no restriction on the like right eye.
No restriction of movements.
Okay. Okay. Then I will move for.
But she has pain, but no restriction of movements.
There is pain. Okay.
Okay.
Then I will check for the field of vision by closing my opposite eyes and opening the like front to front eye. I will sit in the same level and move my fingers from the side in all the 4 directions diagonally and see whether my field of vision and his field of vision is matching in right and left.
Okay. Yes, the left eye, the field of vision is fine, was able to identify nasal and temporal. But in the right eye, there is a little deficit in the peripheral field of vision.
Peripheral field, both nasally and temporally, both.
Yes, both nasally and temporally.
Okay. Then, okay, after that, also actually I will ask for if any color vision, any problem.
Yeah,
Anything?
color vision. So the examiner will ask you to check. There is some red colors and green color something on the table. How do you check?
Okay. I will check separately each eyes to look for what is the color. I will ask her.
Okay. Yeah,
she
she is
able to
identify. She is able to identify, but from far she cannot. You should bring the color nearer to the right eye.
Okay. Then I will check the pupillary reflex by putting the light on the right eye and the left eye. While doing the pupillary reflex, I will check both direct and consensual reflex. So what is the finding?
Yes, in the left eye, it is fine, both direct and consensual, but in the right eye, there is reflex, but it is taking time. There is slow movement of the iris.
Okay.
Hmm.
Okay, then I will check for the accommodation reflex by putting my finger far and bringing near to her like nose. So, what is the reaction with the accommodation
Yeah,
reflex?
there is convergence of both the eyes and constriction. Again, the right eye takes long time compared to the left eye for constriction.
Okay, so in order to complete, I don't know if something forgot, but in order to complete my
Ask
examination,
if
I
there is
would like to complete.
fundoscope. Check.
Yeah, fundoscopy. I will tell fundoscopy. In order to complete, I thought I will tell fundoscopy. Or we can do it.
It is
Okay.
a part of eye examination. You will ask the examiner if it is available.
Okay, so I would like to do the fundoscopy of eyes. Yeah.
Okay. Examiner will say no need. Go ahead.
Yeah. So in order to complete my examination, I would like to complete with the complete other cranial nerve examination and neurological examination, and also look for I need to look for all the vitals. As the child has some Cushing-Gerd features, I would like to look for any steroid toxicity and any underlying illness for which the child is taking the steroids or any other. Yeah.
Okay,
For the cause.
underlying illness. So what you want to check for the underlying illness? What systems you want
And
to?
yeah, in that case, I would like to check for it could be nephrotic syndrome, it could be JIA, it could be
Okay.
then it could be like asthma or yeah, any chronic lung disease.
So you want to check for the causes. So this child has this steroid toxicity, and what do you think by this redness and reduced visual acuity? What problem might the eye have?
Yeah, in that case, it could be because of the underlying illness. So can be associated with uveitis. Those people, those kids can have this restricted movement, eye pain sometimes. Sometimes they may not have eye pain also. Next is its steroid itself cause side effect like glaucoma. So second differential I'll put as glaucoma. Third differential I'll put it as some conjunctivitis, some infection, local infection.
If this
Or
is uveitis,
yeah.
what you will put in the top of your differentials in the steroid from the use of
uveitis, then it is most probably juvenile idiopathic arthritis or some other rheumatological disorders which can be associated with uveitis. Or also can be
okay, JIA
and inflammatory bowel disease also can be associated with uveitis.
Less likely.
Yeah, less likely. First, I will put this JIA only.
JIA, yeah. Okay, I think it was fine. Tell me the management of the patient.
Yeah, this child needs multidisciplinary team involvement, including the pediatrician, ophthalmologist, then ophthalmologist for the eye care, then rheumatologist for the underlying illness, and also for the dietitian because of the weight, and because it's a chronic illness, maybe involvement of the social worker and educational healthcare plan if needed.
Okay. Okay, so here first you will involve the ophthalmologist. Okay, if it is uveitis, do you know what treatment they will give for the eyes?
Yeah, eyes they give cycloplasics and steroid drops because there is chances of what we say, iris gets contracted and gets sticked. So to open up, they put this. Yeah, Sainik. Yes, you are right.
Okay, so if this is JIA and you're seeing some features of Cushing's disease syndrome here due to steroid toxicity, so how do you want to proceed with this case? Already the child is on steroid.
Yeah, so actually we need to reduce the steroid. First of all, external steroid should be, and we can opt for disease modifying drugs alternative to the steroid for this child.
Okay. Okay, I think they will not ask much because that much only time will be there, 3 minutes, and in that you will present and then You will add. Did you present the case or no?
No, I did not present.
Okay.
Directly we went to TD.
Present.
Okay, I'll present. Today I examined a 7-year-old Reema. She looks uh, overweight for her age, and she has some Cushing gut features. I can see there is abdomen distended, puffy, like cheeks. Uh,
Okay.
yeah,
Moonlight.
puffy cheeks and moon-like faces. Yeah, moon-like faces. And on local examination of the eye, I found that there is congestion of the right eye, along with some pupillary dilatation, and there is eye pain associated. There is no abnormality, there is no ophthalmoplegia, but there is a pupillary reflex. Both the direct and consensual reflex is reduced, and there is also reduced vision on the right eye.
Okay. So with this, your differentials, we finished the discussion already. Okay. Yes, you are right. This is a case of uveitis due to JIA, and the patient's presentation like Cushing's features is due to the use of steroids in her. Okay. So since there is redness in the eye, what your differentials you said were nice. You started with the features of steroid toxicity. So after either this can also be put like glaucoma, you can also put glaucoma, no problem, as first, because you're seeing Cushing's features. And also if in the top among all these, like instead of putting nephrotic syndrome, asthma, it is better to put JIA, because JIA is associated with uveitis, right? Like this. Yeah, in the exogenous steroid syndromes. Okay, so for you and for Dr. Satish, both there is one comment. Before going to by yourself asking the child to look into the wall and read what it is, ask the examiner if there is Snellen's chart. Okay, it is preferred than asking on the wall. Usually, chart is preferred. You should ask, is there is any, you should look and you should ask both. If you don't see, you just ask, is the Snellen's chart available? He may say no. Then you will ask to read on the wall. If it is available, you do with it. Okay, this is
for color vision also.
Color vision also ask if there is Ishihara chart. If it is not, you will use some colors, whatever is lying on the deck. And usually you will check for red and green. It's more than enough. Only 2 colors. Both for but each eye separately you will check. Okay, and even for far and near vision, each eye separately you will check. Just ask if there is any Snellen's chart always, and also to read the near vision, any book is fine. And if the child is less than 4 years, any picture book like this. Okay, for children who are not able to read, you will ask for the picture book or any pictures to show on the wall like this. So both of you did not did this, means you did not ask. And even for the fundoscopy, you are telling in order to complete. I think no need to tell in order to complete. You will tell you will do fundoscopy, because fundoscopy is a part of eye examination. If it was some other cranial nerve examination, or if it was cranial nerve, okay, you can offer, there is no time. But in eye examination, fundoscopy is a part of it. At least you can see, if no need to do detailed fundoscopy, you can at least do the red reflex from far. Maybe if some retinoblastoma or something, you will get to know by red reflex, right? So fundoscopy, you will tell, I will do fundoscopy. Then the examiner, I want to do fundoscopy, not I will do, I want to do fundoscopy. Then he will say no need, or whatever, depending upon the availability or non-availability. Okay, I think the case went well, alhamdulillah.
Then in the differential like uveitis, glaucoma, what we can keep, like conjunctivitis also, and the local.
No, because
if they ask more and more, then
conjunctivitis, because this child has pain in the eye, there is redness, there is cloudy, and there is also visual acuity. Problem. Visual acuity and visual field defect. With so much of things, you cannot put just conjunctivitis.
No, yeah. Actually, like, no, what happens is in this JIDDA exam, for each video, they keep on asking like 10, 15, like how, I don't know how many they asked in DD, and they were giving clue for the DDs. They wanted to extract.
Kohalas, give all the steroid toxicity, I mean, all the conditions where you use the steroid, like you said.
Yeah.
First, you can tell that
Okay.
this may be the Cushing syndrome related glaucoma due to exogenous, or even maybe if she has endogenous, you don't know Cushing's disease or anything. But since there is a redness of the eyes, you will put among all these asthma, nephrotic, JIA, among all these, you will put JIA on the top because of the reduced visual acuity and a slow constriction. The constriction of pupil is again slow because of the iritis, not because of the third nerve involvement. Okay. I hope I am clear.
Yes.
Tell us, give all the DDs.
Yeah.
That's all I know. Even I am like you. I don't know if someone.
Anything missed in examination, Dr. Noor? Anything?
No.
Like
Actually,
fundoscopy, you told. Other thing?
That's why I told. But first, always after inspection, if there was squint in this child, you will offer to in the last, like I want to do fundoscopy, like you will also tell I want to do the squint, complete squint examination if there was squint. Since there is no squint, so you will start after inspection, you will start with visual acuity. You will check separately for both the eyes. Okay. Visual acuity for far and near vision separately for both the eyes. And then you will go for the visual fields. Before visual fields, you'll go for color vision. After far, near, and color vision together, all these things, then you will go for visual fields, each eye separately. Then you will go for eye movements, then pupillary reflex, accommodation reflex. I think all these you did. And finally, you offered for fundoscopy, right? That's it. You did everything was covered. That's all we can do. If there is squint, you will offer for squint, and you will prefer doing the other examinations of the squint. Okay. And during the 6 minutes, since you are just talking to the examiner, no, Dr. Satish, your time management was little deficient.
Yeah.
Explaining too much. I will sit in front and just tell the examiner I will examine the visual fields, each eye separately, by sitting in front of the chair and closing my opposite eye. Okay. Closing each other's opposite eye. That's more than enough.
And
he will give the finding. If he asks you in detail how you will check, then only describe him. Because if you start describing how you will check, your time will go. And they may ask you only in 1 or 2 places, maybe. I don't know if they want how you will check. Just tell. Not for everything they will not ask because of the time management. Don't go to describe. Just tell I want to check for the color vision. So I will use this green and red, or is there Ishihara's chart? First you will ask. If it is not there, you'll use the green and red color like this. Just go on. If he asks to describe, then only you describe. So there was some problem in your time management. Otherwise, even you said the Cushingoid features, but the only thing you did not correlate was this uveitis and JIA, which is
I could not because I could not correlate this corneal clouding with the uveitis. Actually, this is so I was thinking more of this corneal clouding. I was obsessed with this.
No, it can come. It can come. It can happen. Corneal clouding can happen with uveitis. Another thing was more than MPS features. It was the child. That's why the general is more important. I don't think she had that much of MPS.
no, not no.
MPS was not there.
No.
Right. So
Yes.
just think. It was a clear Cushing's with the moon-like face and distended abdomen, thin legs. I will share the picture again. And so this is what you missed, but forget, it's okay, no problem. We are putting just the differential diagnosis, but your approach is more important. Marks is not just for the DD. Your approach, your presentation, everything carries a mark. Mark, but you did a good attempt. But only thing is you did not correlate with these things, these two things. This is the only thing. Then in order to complete my examination, the thing you were missing is I asked you, I prompted you, one thing you are missing, tell. You will examine the arthritis for joints. In this case,
Arthritis and myopathy also, and abdomen for ascites also. All the features of, I think, to which are related to steroid toxicity.
yeah. Okay. So I don't know anyone got this case before in the exam or not. I don't know. This case is from Mark. Okay.
Yeah.
I don't know. Anyone has any experience that this case came before in exam?
But any case with steroid
Which case?
toxicity can come in exam, like you
Eye examination.
yeah
Okay.
can come.
Eye examination is common. Yeah, uveitis, maybe it can come.
Okay.
Okay, so can we move, Doctor?
Yeah,
to the
just
next?
wait one minute.